Timing, growing pains, and possibly the use of ambulances for non-emergencies, all multiple factors that led to a logjam of patients at Wynn Hospital's ER yesterday.
Families and patients are upset, and MVHS is exploring daily how to improve the situation. News Channel 2's Jolene Ferris has your top story.
A local family is filing a complaint against Utica's Wynn Hospital with the state health department following a family member's recent emergency department visit. They called the hallways a scene from an apocalypse and said they feel our community is at risk. MVHS administration members were in the emergency department on Tuesday during this logjam of patients.
We acknowledge that, that yesterday is not the way that we want things to be. And I truly believe that as we move forward, that things are actually, that days like yesterday, which thankfully are already pretty darn rare, are going to become even more rare.
A confluence of many things led to the backup of patients in the emergency department Tuesday. For one, a lot of people are sick right now.
And I can tell you, because I've worked in emergency departments for 40 years, the day after a long holiday is always very busy in an emergency department.
Tuesday was, and that meant it took a long time for paramedics and EMTs to turn over patient care to hospital staff, and they can't just leave the patient until that happens. This can tie up EMS staff and ambulances for hours, keeping them from responding to other emergencies.
We had one ambulance that was out of service for 5 hours once they arrived to the hospital. We couldn't transfer patient care.
At one point, all 3 of Utica's ambulances that were in service were tied up at the hospital.
There was a point yesterday that for a medical emergency at Focus Rehab, Cedarville ambulance had been dispatched.
Another contributing factor to long ED waits, people using ambulances for legitimate medical problems, but that might not be of an emergent nature.
There's also some areas where they're experimenting with alternate destinations for ambulances. Right now, under law, we have to transport a patient to an emergency room. We can't take them to urgent care. We have to take them to a hospital. It's almost backwards. They're being incentivized to transport instead of incentivized to treat the patient accordingly.
Dr. Hall says MVHS has hospital-wide huddles and specific department huddles daily, looking for ways to improve care. With regard to Tuesday's patient backup in the ED, how to adjust processes that work under normal circumstances to accommodate a rapid influx of multiple ED patients.
How do we modify those in a way that, number one, continues to take care of patients, number two, doesn't cut corners from a clinical care standpoint, but number three, actually increases and improves processes of moving patients through the system.
Jolene Ferris, News Channel 2.